Colon cancer is the third leading cause of cancer death in the United States, and 1 in 20 Americans will actually develop colon cancer in their lifetime. Unfortunately, about 80% of the time, there are no signs or symptoms. Unlike most cancers, colon cancer can be prevented in 90% of the cases if caught early enough. It's very unfortunate because a lot of patients shy away from having their colonoscopy because they suspect or they have a fear that we will find something. The main reason we do colonoscopies, again, is to look for colon polyps before they turn into a cancer. So by putting it off, you're putting yourself at a greater risk for this cancer to develop. It's better to catch it while it's small, that we can remove it and cure it in the office, than dealing with the consequences of a cancer later on. There are other screening methods that are available. They're not as accurate as a colonoscopy, but they do exist. Other tests include CAT scans, barium enemas. The CAT scan isn't as specific as a colonoscopy. A barium enema can be uncomfortable. There's no sedation with that. There are virtual colonoscopies, and the technology is still developing. The last is fecal occult blood testing. It measures any type of microscopic blood in the stool, but again, this is also not as accurate as a colonoscopy. Everyone of average risk should be screened at age 50. If you're African American, you should be screened at age 45. If you have a family history of colon cancer or colon polyps, you might need to be screened earlier. And if you have any new onset symptom that you feel warrants further investigation, do not hesitate to call us so that we can investigate and hopefully determine the source of the problem and potentially treat and/or cure.